All right, our last video, or our last chapter, the female reproductive system. This is kind of a big one. The female reproductive system is responsible for so much more than the male reproductive system. And this chapter is going to cover gynecology, obstetrics, and neonatology. So first I'm going to go over the function and anatomy of the female reproductive system. Then I'm going to go over the word parts specific to the female reproductive system, obstetrics, and neonatology. So the function, just like the male reproductive system, the female reproductive system produces the gametes, the female gamete, the egg, the ova. But unlike the male reproductive system, the female reproductive system is also responsible for then the gestation period, where the development of that new offspring, the zygote, embryo, or fetus. So the zygote is formed by the fusion of the egg and the sperm, and it begins to divide, and as it grows, when it becomes implanted into the wall of the uterus, we're still referring to it as an embryo for several weeks until we finally start to refer to it as a fetus somewhere around 10 weeks. And then the female reproductive system is also responsible for the delivery of the newborn, actually getting it on out. It's a little more complicated than the male reproductive system is. The study of the female reproductive is gynecology. Treatment of a pregnant woman along with the developing fetus and delivery of the newborn is known as obstetrics. And then the study and care and treatment of the newborn is neonatology. Physicians will specialize in both gynecology and obstetrics. They seem to go together pretty well. They're the OBGYNs. But neonatology typically is a different specialist. So the external female anatomy looks a little something like this. Working our way from the outside in, you have the outer lips. Labia means lips. These are the labia majora, or large lips or outer lips. Inside that, you have the inner lips, or labia minora. Up at the top here, you have the clitoris, which is anatomically, it's the same as the penis. It has the same sorts of erectile tissues in it. It just doesn't have the urethra. Again, in the female, the urinary tract and the reproductive tract are completely separate. So here you see the urethral meatus, or urethral opening, and then you have the vaginal opening. And then between the vulva, which is the external genitalia of the female, between the vulva and the anus, you find the perineum. If you look at the internal anatomy of the female, you can see the ovaries, which are the gonads for the female, and then the oviducts, or fallopian tubes, left and a right one, that bring the egg or the zygote down to the uterus. The uterus itself here has three layers. The inner lining of the uterus is known as the endometrium. Endometrium. Endo means in, metria refers to the uterus. So this is a tissue on the inside of the uterus, endometrium. This layer of the uterus, as of puberty, this layer grows thick and very blood-rich during a portion of the monthly cycle, and prepares for an implantation event of an embryo or a zygote. If there is no implantation event, then that portion of the endometrium is sloughed off during the menstrual period. You have the myometrium, the muscle layer. So this is a smooth muscle layer that makes up the most of the thickness of the wall of the uterus. That functions primarily during labor and childbirth. Although during the monthly cycle, these muscles will contract and cramp. Then the outer layer of the uterus is known as the perimetrium, or the tissue around the uterus that surrounds the outside of the uterus. Down here, the uterus narrows into a neck called the cervix. This is the cervix of the uterus. Again, cervix just means neck. Extends down into the top of the vagina. The vagina itself is this canal, sometimes referred to as the birth canal. The uterus doesn't sit upright like this on top of the vagina. If we look at it in sagittal section, you see the uterus, the non-pregnant uterus, kind of flops over on top of the urinary bladder. And at this point, I'm just going to mention this is the urinary bladder. This is the female urethra. And notice it is completely separate from the reproductive tract. The vagina sits posterior to it. And then posterior to that, you have the rectum. Also, I want to point out in this particular image that they've removed most of the intestines. This is not hollow space here. This is actually chock full of small intestines and colon. It's not just hollow space up there. Again, just to show you, this is the vaginal opening here. This region is called the perineum, and that's going to become important in some of the vocabulary later on. The breast tissue is not actually part of the reproductive system itself. It's more of the neonatal system for feeding the newborn. In the non-lactating breast, you see a lot of adipose tissue, and that makes up most of the size of the breast, and some rudimentary mammary tissue, the glands that actually produce the milk. In the last trimester, and as long as a child is suckling, the mammary tissue, the actual glandular tissue, proliferates, and that can cause the breast to increase in cup size to produce the milk. Then the milk is let down through this system of ducts to these varicosities, these wide places. And then upon suckling, or at least to the sound of an infant crying, the milk is let down to the nipple itself. All right, get on with some terminology here. Colpo and vagino both refer to the birth canal, the vagina. So a colposcope is a device used to look at the vagina. Vaginitis would be an inflammation of the vagina. Apesio and vulvo both refer to the external genitalia. So an episiotomy is an incision into the external vulva. Used during childbirth, they may make an incision to ease the passage of the head and shoulders, because that incision is easier to sew up later than if it tears during childbirth. That's an episiotomy. Vulvodynia or vulvodynia would be pain in the external genitalia. Perineum, again, that's that region between the vulva and the anus, which in some cases can become damaged during childbirth. And so a perineoplasty would be a surgical repair of that. Perineorrhaphy, a suturing of that. Gyneco and gyno, so this is basically a study of women and a specialist in women. Masto and mammo both refer to the mammary glands, the breasts. So a mastopexy would be surgical repair of the breast. Mastectomy would be removal of the breast tissue. And a mammogram would be a picture of the breast, an x-ray typically. Lacto refers to milk. So lactation is the activity of producing milk. Lactorrhea means milk flow. Cervico in this context refers to the neck of the uterus. If you're experiencing pain in the cervix, that's a cervicodynia. Or if there's inflammation of the cervix, it's cervicitis. So again, the C can be hard or soft. In cervicodynia, it's a K sound. In cervicitis, it's the S sound. Hystero, metro, and utero all refer to the uterus. So a hysterectomy would be a removal of the uterus. The endometrium, as I mentioned, EM is a tissue that's inside the uterus. It's the inner lining of the uterus. And of course, uterus from utero. Pelvi refers to the entire pelvis. Pelvimetry would be measuring the pelvis, specifically measuring the pelvis to make sure that it's wide enough for that particular fetus's head and shoulders to make it through. You can do pelvic sonography, so that would be a procedure to use sound waves to view the pelvis. Two pronunciations here, oophorio or oophoro or oophoro. Either one can be used, or ovario. Both refer to the ovaries, so this can be an oophorectomy or an oophorectomy. I've heard it both ways. Ovariocentesis. Remember, centesis is puncture. Usually that also means they're going to withdraw some fluid. Meno comes from the word meaning month. In this context, it means menstrual or menstruation. So menorrhea is your menstrual flow. Menopause is a cessation of menstruation. Salpingo. Salpingo refers to the fallopian tubes in this context. So a salpingectomy would be removal of the fallopian tubes in this context. A salpingoscope would be used to look at the fallopian tubes. In the context of the ears, remember, salpingo refers to the eustachian tubes. So what we're looking at here is a fairly early pregnancy with a very small embryo. But what I wanted to use this image for is to explain the placenta. So what you're seeing here is on the far right, the very far right, is the myometrium, the muscle layer. Then this is the endometrium. This is maternal tissue. And then from the embryo tissue, you see the chorion here has these blood-rich finger-like projections. Ultimately, the chorion and the endometrium will enmesh like you can enmesh fingers, like when you cross your fingers, to form the placenta. So half the placenta is embryonic tissue and half the placenta is maternal tissue. I'll point something else out here. This endometrium extends all the way around that developing embryo. the chorion is inside the wall of the uterus. So for all 9 months, that fetus is going to develop inside the wall of the uterus. There are other membranes involved. This is a yolk sac. We don't need to really talk about that much. This is the umbilical cord that leads to the placenta. And then you have the amnion. The amnion is a membrane that surrounds, that's closest to the embryo itself and contains the amniotic fluid as well as the embryo itself or the fetus. And that's going to become important for some of our upcoming terminology. Like amnio refers to that membrane that's around the closest membrane to the developing fetus. A common procedure is an amniocentesis, which again literally means puncturing that membrane, but it's to withdraw some of that amniotic fluid because it will contain some fetal cells that you can then do tests on to test for different kinds of genetic disorders and things like that. Generally monitor how well the pregnancy is going, how well the development is going, things like that. Cyesis refers to pregnancy itself, the state of being pregnant. So pseudocyesis would be a false pregnancy. Chorio or choriano refers to that membrane that becomes part of the placenta. It's the embryonic tissue. As soon as the embryo starts producing a chorion, the chorion produces a hormone called human chorionic gonadotropin, and that is what's tested for in the urine of a woman who thinks she might be pregnant. That's why you pee on a stick, is to test for that hormone that can only be made by a chorion. So it can only exist if there's an embryo that has a chorion that's producing that hormone. So choriocarcinoma, of course, would be a cancerous tumor of that membrane. If it's inflamed, it's a chorionitis. Toco refers to the actual process of labor and birth itself, giving birth. So dystocia or dystocia would be a difficult birth. Something's gone wrong, so there's a problem with the birth. You can do a tocograph, which typically is monitoring the heart rate of the fetus/newborn during the process of childbirth. Feto refers to the fetus itself. Fetometry would be measuring the fetus, and typically, again, it's going to be measuring the size of the head to make sure it can fit through that particular mother's pelvis. Parto and nato refer to giving birth. Parturition is the act of giving birth. Parto is specific to the mother, and nato is specific to the fetus/infant. So when you see a word like postpartum, that's referring to the mother after birth. Neonatal is referring to the infant just after birth, when it's newly born. So they both mean birth, but prepartum and postpartum is always in reference to the mother, and prenatal and postnatal is always in reference to the fetus/infant. And that is the last of the last video.